How do you get the cholesterol, the LDL, to be lower or the HDL to be higher? What do you have to do?
So we recommend, first of all, healthy lifestyle. So we recommend healthy diet, healthy exercise, keeping your weight down. But then to lower the bad cholesterol in particular, we have a very common medicine called a statin drug.
And those are wonderful at lowering that cholesterol.
They are.
Are lots of cardiologists on statin drugs?
Most of them.
Yeah.
Probably
Yeah.
90% of cardiologists take statin and an aspirin, a baby aspirin.
You know, and I'm on a statin too. My father had high cholesterol levels, had hardening of the arteries, and so I just didn't play around. I started on a long time ago.
Yeah, very smart.
And so blood sugar?
Blood sugar. So a fasting blood sugar should be under 100. And what we used to call borderline is really a mild case of diabetes. Most of that diabetes, though, is called type 2 diabetes, and that can oftentimes be corrected with exercise and weight loss and dietary changes.
Type 2 diabetes, diet control sometimes, still a risk factor for heart disease, though.
Yes, it's a major risk factor. In fact, we call it a heart disease equivalent.
So if you've got type 2 diabetes or diabetes of any kind, you need to pay attention to it, get that under control.
Very much.
How about smoking?
So no smoking is good. No smoking, even so cigarette smoking or really smoking of any kind. And we do everything we can to help our patients to quit.
So the other things as far as risk factors would be, how about inactivity, sedentary lifestyle, obesity? Are those risk factors?
They absolutely are, yes.
And how about age?
Right, so age actually is not modifiable. You know, year by year by year, we gain that risk factor, and that is certainly a risk factor. That's why I say with middle age and older people, we see more and more heart disease.
So if we look at our risk factors and we have a history and physical by our primary care physician, we can begin to guide a lifestyle to where we can hopefully not have heart disease, that we can prevent heart disease.